Anemia is a condition characterized by a deficiency in the number or quality of red blood cells or hemoglobin in the blood. Hemoglobin is crucial for transporting oxygen from the lungs to the body's tissues and removing carbon dioxide. Causes of anemia. 1. Iron deficiency. This is the most common cause globally. It can result from inadequate dietary intake of iron, poor absorption of iron from the diet, e.g., due to gastrointestinal diseases, or increased iron requirements, e.g., during pregnancy. 2. Vitamin deficiencies. Vitamin B12 deficiency. Essential for the production of red blood cells. It can be caused by dietary insufficiency, common in vegetarians, vegans, or absorption issues, pernicious anemia. Folate, vitamin B9, deficiency. Required for DNA synthesis and red blood cell maturation. Inadequate intake or absorption can lead to anemia. 3. Chronic diseases. Conditions like chronic kidney disease, inflammatory diseases, e.g., rheumatoid arthritis, and certain cancers can interfere with red blood cell production or lifespan. 4. Bone marrow disorders. Disorders such as aplastic anemia or myelodysplastic syndromes affect the bone marrow's ability to produce enough healthy blood cells. 5. Genetic factors. Inherited conditions like sickle cell anemia or thalassemia affect the structure or production of hemoglobin. 6. Hemorrhage. Acute blood loss from injuries, surgeries, or chronic bleeding, e.g., gastrointestinal bleeding, can lead to anemia due to the loss of red blood cells. 7. Chronic inflammation. Conditions associated with chronic inflammation, e.g., autoimmune diseases like lupus or rheumatoid arthritis, can interfere with red blood cell production and lifespan. 8. Medications and toxins. Certain medications, e.g., chemotherapy drugs, or exposure to toxins can suppress bone marrow function and cause anemia. Symptoms of anemia: fatigue, weakness, shortness of breath, pale skin, dizziness or lightheadedness, cold hands and feet, irregular heartbeat. Treatment of anemia depends on its cause and severity, but may include dietary supplements, medications, treating underlying conditions, or procedures like blood transfusions. Regular medical checkups and blood tests are important for diagnosing and managing anemia effectively.